start by people having roll call, but we'll also introduce ourselves to you and tell you a little bit about just, where we are, who we represent. But I'm not sure if we are missing anyone.
I will scan really quickly.
Thank you.
It looks like we might be waiting for Sharon Bashan.
Okay. All my other Zoom meetings, my pronouns stick with my name, but for some reason on these, I have to add it in. I'm not sure.
Just Sharon.
Okay, so just Sharon. So I'm going to check with the chair of our working group who's here to see if we should wait or go forward.
Yeah, I mean, Erica, I would just say, let's just go ahead. Let's plow ahead.
Okay, we'll plow ahead. And then I don't see, let me see, I do see there's 2 attendees in the public who may or may not have comments. But first, would you like to take roll call, Christopher?
Yeah.
I just interrupt you for a moment. As roll call is taken, would you mind just giving a little introduction of yourself so our guests will know who you are and where you hail from? Go ahead, Christopher. Thank you.
Thank you. My name is Christopher McConkey. I'm with the Office of Access and Inclusion. I'm a staff member to this subcommittee. Roll call begins. Bashan. Felmuth.
Here. My name's Julie Felmuth, and I'm retired, but for 33 years I worked at the Center for Public Interest Law at the University of San Diego School of Law, and our job there was to run an academic and advocacy program studying occupational professional licensing agencies like the State Bar, like the Medical Board. So I'm very familiar with those kinds of occupational licensing agencies.
Thank you, Julie.
Hamilton.
I am Stephen Hamilton. I'm coming to you from technically Arroyo Grande, but also Pismo Beach, California. That is where Bugs Bunny was headed before he took the wrong turn in Albuquerque. I've been a family law attorney for 26 years. I actually became a lawyer in a non-traditional way. I went through the law office study program after finishing my first year at Hastings. So I self-taught for the last 3 years and then took the bar and passed the bar exam. I am the representative from the California Lawyers Association. I think part of the reason I was picked as the prior chair of the state family law section, but also family law was, we knew, one of the most significant areas that was going to be addressed by the paraprofessional program. I've been a certified family law specialist for 15 years. When I renew it, I'm also a MCLE provider, and I can offer courses that provide legal specialization in family law, and I'm a fellow in the American Academy of Matrimonial Lawyers. Thank you.
That's great. Thank you, Steve. I'm sure you were also selected for your reasonableness and great, personality.
That's very sweet of you. Thank you.
Yeah. Okay.
Kirkmeyer.
I'm Kimberly Kirkmeyer, and I'm actually the director of the Department of Consumer Affairs. I've actually only been in that position for about a year, and prior to getting into that position, I was actually the executive director in multiple other positions at the Medical Board of California, and my whole career really has been with the Department of Consumer Affairs. And the Department of Consumer Affairs is a entity that oversees 37 different boards and bureaus that regulate about 250 different business profession types, as well as 3.5 million licensees. So a lot of the regulatory scheme is under DCA.
Kimberly has been so helpful in kind of comparing our system with like the medical board system and others, so we can learn from that. Thanks, Kimberly.
Sharon Bashan, we're taking roll call. So the chair has asked that each member also introduce themselves for our guest speakers. So Bashan.
Thank you, Kristen.
Oh, thanks. Here, should I introduce myself right now?
Yeah, if you don't mind.
Oh, sure. I am Sharon Bashan. My camera is working today.
Yay.
So you're seeing my poofy hair, sorry. I am the Pro Bono Justice Director at One Justice. And I represent, I guess, the legal aid sector on this working group. Happy to be here.
And I was thinking you were having a really good hair day.
Thanks, Erica.
Thanks, Sharon. Okay.
And then Petru.
So my name's Ioana Petru, and I chair this illustrious working group as of a few weeks ago. So I'm on the Court of Appeal in the 1st District, which is in San Francisco. And previously was on the trial court in Alameda County, primarily Oakland, having had a pretty wide array of assignments on the trial court. And before that, a mix of both public and private work on both sides of the aisle, both defense and prosecutorial or plaintiff side.
And we're in really good hands, in our current chair's hands. So, and then others, should I call on them? Maybe, Andrea, would you like to introduce yourselves, please?
Oh, sure. Hi again. Andrea Fatanides with the Office of Access and Inclusion. But since we've already had a chance to meet when we spoke about this committee last week, I just wanted to thank you again for taking time to come and speak to us so that we can, benefit from the great work that you've done with the program.
Thanks, Andrea. And then Greg?
Hi, everyone. I'm Greg Fortescue. I'm a lead attorney for the California Supreme Court. I sit in the Civil Central staff, and one of the things that I'm honored to do is sit on a lot of state bar task forces and commissions. My job is really to observe, be an accurate historian for the court, and eventually, if the recommendations of this group are adopted by the Board of Trustees, I will present those recommendations to the court at their administrative conference and make recommendations myself.
Thank you.
Nice to meet you all.
Thank you. And then I'm not sure, Leah is in the attendees. Should she be promoted? And then also Sharon, would you like to introduce yourself?
Meet myself. Hi, everyone. Nice to meet you. I joined the State Bar last October, so I'm still fairly new. I'm in the Mission Advancement Division and just mainly assisting Linda with scheduling these high volume subcommittee meetings. So again, nice to meet you all.
That's a great name for your division, Mission Advancement.
Yes.
Great. Brady, would you like to introduce yourself?
Hi, everyone. I'm Brady Dewar. I'm an assistant general counsel at the State Bar. I attend a lot of these commission meetings to answer process legal questions and also larger legal questions as they affect the bar as an organization. I'm actually filling in a childcare gap for the next 15 minutes or so here, and then I'll be back on video. So look forward to smiling at you all.
Thank you so much, and thanks for letting us know. And Leah, would you like to introduce yourself?
Sure. I'm Leah Wilson, and I'm a consultant providing staff support to the working group effort. Thank you for promoting me, Judge.
Yes.
I was trying to navigate the controls, feeling really helpless. I can't speak. I can't do anything.
I know. Yeah. That happened to me last time. Linda's on vacation. So what happens when Linda's on vacation?
Yeah.
But I'm glad she has some deserved time off. May I ask for feedback? Would you like us to have some public comments now before our speakers present? I don't see any hands up though for the attendees. Do any of the attendees wish to make any public comment? If so, could you please raise your hand now? Looks like there's none. So we're just so pleased to have Ms. Robertson and Mr. Kozrovian here to help us understand some of the tasks that we're going to be addressing. They said that they're both graciously willing to allow us to ask questions and interrupt them. They have a PowerPoint slide, and I'm going to see who would like to start them off. And if you want it to be shared by Christopher, or if you want to share the slide.
I can post it because I didn't send it to Christopher, so yeah.
Thanks.
So let me bring it up here. Hopefully I don't give everyone my entire desktop. So let me try to get this.
If that happens, we'll close our eyes.
Oh, I'm not hiding anything.
Not happening. Perfect.
Okay.
Thank you.
Does everyone see the? Yeah, I'll let me see if I'll bring it to the slideshow. There you go.
Okay, good.
Can see it.
Yeah.
Thank you.
Okay, great. Yeah. So first, I want to thank everyone for inviting us. Really appreciate it. Any opportunity we get to talk about the pilot project because it's a smaller, not as well-known program within our division, within our department. So we're in the Office of Statewide Health Planning and Development. It's a long acronym. Potentially might be changing into a new department if anyone pays attention to the Health and Human Services Agency budget in the new governor's proposal. I don't know how many here are read that whenever they feel like it, but we are potentially becoming a new department, but that's, probably a year or so down the line. And we work within the Health Workforce Development Division. So our focus is to increase healthcare access for the underserved and the rural communities, basically to try to address any kind of workforce issues within the state on healthcare. So one of those programs is the Healthcare Workforce Pilot Project, which has been around for quite a while. Gloria, correct me if I'm not mistaken, but at least since the early to mid 70s. And Gloria is very familiar with it. She's been working on the program for a very long time. So the slide that we have up now is kind of a flow chart of how the process works. We have regulations, we have statutory requirements. So there's quite a large depth of material out there to really inform people on how to come forward to request a pilot project. So the main focus, though, is that it allows someone with an idea to say, hey, we know there's an issue on this sector of healthcare. There's an access issue. There's an issue about getting people treatment, whatever it may be. We have an idea. We have a project we want to pilot, basically, but either suspend the scope or expand the scope of a profession. So we have the authority to basically allow that to happen for a limited time to kind of try it out and see how it works with oversight and all the details that we're going to go into. But that's kind of the in a nutshell, that's what the program is. So I'll let Gloria.
Can I interrupt to just sort of
Sure.
maybe give us a little bit of context? Can
Sure.
you sort of set the stage for us and help us understand who are the clients who are served and who's doing the serving?
Sure. A lot of it depends on who the project sponsor is, what the application is for the project. Primarily, it's usually an institution or it could be a state agency. Like one example is right now, we just actually finished up the Emergency Medical Services Authority was doing a paramedicine pilot project. The main focus was to have community paramedicine take one example is they had a couple of different ideas that kind of compiled into one. One was to take people to one idea was it's not always the ideal situation to take someone to the hospital for treatment for something. And let's say the next example, it's like it's an addiction issue. It's an issue with mental health. Clearly, the hospital, they can go there, but a lot of cases, they weren't equipped to handle someone that was going through an episode or was going through any kind of addiction issues. So one of the things they did is they decided to relay them to sobering centers. That was one idea. Another was an idea for the community paramedics to take potential patients to areas that are not within the hospital, so more like urgent care centers, things like that. So there was a few different ideas, but it was primarily promoted by the Emergency Medical Services Authority as a pilot to expand the community paramedicine project scope. So generally, it could be anyone that has a sponsoring entity. So if you're going to suspend rules or expand them, it has to be the entity that's in charge of that, that's approving it. And I don't want to go too much into all the details. I'll let Gloria kind of take over some of the more finer details. But Gloria, if you want to kind of jump in and let them know some more specifics on who can and can't request these kind of things.
Okay, Leah has her hand up. Oh, sorry, Leah,
Sure.
did you have a question?
It's just a related question, and Kim, you might answer as well. Did the nurse practitioner or the physician's assistant licensing changes, did they go through the pilot?
Yes. Yeah, go ahead. Sorry, Gloria.
Yeah, this whole thing started in the 70s as with the excitement of trying to make the healthcare system a little bit more effective. And so during those early stages, there was the nurse practitioner concept, physician assistant concept, and everybody was excited. I was a student at the time, so I wasn't excited. I had to learn. But I remember a nurse friend, a registered nurse friend, borrowing my physics books. I don't know what physics had to do with the price of that. But yes, the nurse practitioners came through, physician assistants came through, dental hygienists came through, paramedics came through, yes. And so who may apply and to participate? nonprofit education institutions such as UC San Francisco, University of Pacific as examples, community hospitals or clinics, government agencies such as IMSA, has just died off on our vine here, meaning that as of this year, they are able to develop the community paramedic program. So the excitement came early on, trying to assist the system in trying to provide a better effective program. So therefore, the HWPP program used to be called Health Manpower Pilot Projects Program. And so that was the legal umbrella for pilot projects relating to a scope of practice and other projects to be had in the state of California. And so, and there we went. Okay, are there other questions?
Oh, sorry, I'm so sorry to interrupt. So is your charter to help these various programs go through the pilot process, like the nurse practitioners and the paramedics?
The answer to that is, for the most part, yes. Sometimes applications come through and they're not necessarily approved to be piloted, but most of the time they are. And so this is an authoritative process where for people who want to apply to increase the scope of practice, design, and test concepts can do it legally. Because of course, the scope of practice is not in place, therefore you need to provide data to the legislature to show that you have a promising concept and data that shows healthcare promises, yes.
And one of the aspects is that so we're oversight, but we're oversight of the project, not necessarily oversight of the professions that are expanding or expanding their scope. That's left to whoever is the you could say like licensing entity. Like in this case, it was EMSA. That was a community paramedicine licensing, or let's say nurse practitioners. Well, that case that was probably long enough ago that area wasn't a board yet for that, but there's somebody else that kind of puts together the criteria for what that profession is supposed to be doing. So in this case, it's someone that's at least the level of that profession or higher or entity. So we kind of are the oversight. So we're more responsible for making sure the people that propose the project and were approved through our process are following what they said they were going to do with regards to safety measures, the scope that they requested to change, and then that there's also data collection. So kind of like more like outcomes. So that when one of the objectives is, of course, if it's successful, they'll go to the legislature and show them the data, to show them the evidence of its success, and potentially request, legislation to authorize it. Which in the case of EMSA, that's what happened with the community paramedicine. There was a lot of different ideas they had. They kind of settled on the Gloria. It was like the two ideas that really settled: the sobering center, and I can't remember the second one that kind of settled with EMSA. But they went to legislature and said, "Hey, we've been doing this. I think we went on 6 years with them." And they were able to add more sites. I think they add up to 22 sites. And as time went on, they were collecting data, doing evaluation reports to show the success and any kind of concerns and how they address those concerns. And ultimately going to the legislature and asking, we believe it's time to make this permanent. And the legislature would pass the law saying community paramedicine in these fields now have this expanded scope.
Thanks. So I wanted to just say that I can't see everyone sometimes when the screen is shared, so I won't be able to see all your hands, although I have the participant list open and I'll check. So if you have a question, please just jump in, including Bonnie, who's joined us. So also just a context question, to give us a sense, how many entities have you helped go through this process? And then we can start asking more about like evaluation tools and stuff like that. But so how many entities have you worked with going through this pilot process?
We've had at least 174 applications coming in. Not all have gone through the process. I would have to look at the chart to find out exactly how many we've had, but we've had a substantial number of projects over the years to go through the process, wherein it may be that some projects were able to develop a better curriculum to facilitate teaching. It may have been that there were scope of practice issues that came forth. So it's kind of like, okay, let me check and see if I see the chart real quick. I can tell you exactly. Oh, maybe not.
Well, it sounds like a lot of applications that you've gone through, and part of we're taking a sliver of one of the things we have to think about, which is how to evaluate how to evaluate outcomes and when we think about setting up a pilot program. So I'm sorry, Gloria, did you want to add anything?
Well, I know you were talking about evaluation criteria. Two things in terms of the person applying must talk about how she will evaluate the project themselves. In other words, what's going on. So we asked for progress reports from them so they could tell us how they're progressing with what they thought that they wanted to do, timelines included. The other thing is that we evaluate and monitor the pilot projects also. We may visit sites to see what they're doing, to evaluate how they conduct their business, talk to the participants to see what they think of what they're doing, good or bad. And then we also require progress reports that's in writing. It tells us, how they are themselves are monitoring the process. So those are two methods, yes.
Thanks. Leah has her hand up. And so does Sharon. Leah and then Sharon.
So I'm just curious in terms of the scope of the pilot. So let's say it's a I forgot what you call it, but it's a pilot for scope of practice. You're in that category. And so someone comes to you with an application and they say, okay, I want to implement this pilot to see if, I don't know, let's make something up. Now nurse practitioners can perform surgery or something, okay? I want to implement this pilot with all nurse practitioners in all 58 counties. So that, to me, it's like, oh, that's not really a pilot. That's everybody doing it statewide, right? Or somebody came and said, we want to do it at this one hospital. Are there any parameters that your agency sets around what constitutes a pilot? Like in terms of geographic scope, numbers of the practitioner population involved, anything like that?
Well, yes, several things. For one, the pilot must talk about whether they're going to teach new skills to existing categories of healthcare personnel, whether it's going to be a new category of healthcare personnel. Well, it has to do with accelerated training of existing categories of healthcare personnel, or teach new healthcare roles to previously untrained. So those are kind of like the aims in the demonstration project itself. Now the applicant has the ability to say, I would like to test this concept. I will use abortion project. That's not a nice, I'll use the dental project, where University of Pacific wanted to test the idea of having dental hygienists in certain levels to perform regular processes and then to do replacements. And so they said, okay, in the application itself, we would like to test this concept in several settings. For example, students that are in elementary school, or students that may be in that kindergarten or whatever, the ages. And then they may also say, okay, I want to go out to a skilled nursing facility to test the concept. Or I may want to go into a home-based care facility to test the concept. So those are facility settings where they may want to test that one type of concept. Now, in the case of the last project we've had, they had several concepts that they wanted to test in several parts of California. So we look at the application to see what it says, whether it matches the criteria that's in regulations itself. And then, of course, we have an interdisciplinary team that reviews the applications themselves, such as Ms. Kirkmeyer, who's here. She's been on one of our committees, to ask them to evaluate the application itself, provide us feedback regarding whether we should approve the project for piloting or deny the pilot for projecting. And then, that notwithstanding, we'll set up a public meeting where we can discuss the various concepts and criteria in the application itself before we go to the director. Does that kind of give you kind of a flavor for what we do?
Yes, I know. I see other hands up.
Yes, Sharon is next, and then Kimberly.
Hi, this question is for Gloria, and this goes towards evaluation and how deep you're going into evaluation. For example, are you, in addition to surveying, the professionals, are you getting feedback from the doctors or other professionals that are in that setting, maybe people within the nursing home, if that's where the concept is being played out, to get their take on the level of service, the quality of service, as well as patients, both from a immediate customer service satisfaction level, and then maybe even like longer term health outcomes standpoint.
To begin with, we do not interview the patients since we've had that the HIPAA rules come in. We don't deal with the patients themselves at all. We do interview the management team that's related to the project. We do interview the personnel that's at a particular setting. We interview the practitioners who are performing the service. And so we get that information, but we also can and do in some projects ask them to pull abstraction records, medical records, so that we can see what they have done and the kinds of comments that have been placed in the patient's records. So we have a chance to look at that, and the professional team, the interdisciplinary team, may include different disciplines from the Department of Consumer Affairs, such as the Medical Board, the Board of Registered Nursing. If it's related to dental, be physician assistants, dental hygiene, the dental board. And then we'll also look at professional organizations related to the subject matter, such as CMA, CNA, and the like. So they are we ask them to be a part of our interdisciplinary evaluation team so they can review the application. They've done that. So now that the project is being implemented, they can review the progress of the project based upon what we have approved. And they have a chance to join us in site visits to be on site to evaluate what's going on also. So yes, MDs, nurses, dentists, dental hygienists, depending upon this type of project, are involved with the evaluation process.
Thank you. Kimberly is next. Oh, I think you're muted, Kimberly.
There we go. So thank you, Gloria, so much for being here and giving us the information. I just have a quick question, kind of in follow-up. So from all the programs that I've been involved in, it's been more of a, the individual's already licensed in that, but what they come to you for is to expand their scope. So, dental hygienists, I think it was to expand them right into doing extended functions. And for, nurse practitioners and physicians, like on the abortion side, it was to expand what they were doing. So just going back to the original of physician assistants and nurse practitioners on that question, did they come to OSHPAD and to HWPP to do the actual licensing and the original start, or was it more when they started to expand what they wanted to do and trying to do regulations for scope expansion?
Thank you, Kimberly, and thank you for participating with us over the years. I appreciate your comments and your efforts. In terms of the nurse practitioners and the physician assistants, years ago, there was not a license category for them. And so the hooray excitement was to see whether or not that they can develop a professional licensing category called nurse practitioners. And so the applications came in from several sites to demonstrate what they thought a nurse practitioner should do, or what a physician assistant should do, or a dental hygienist should do. And so over the period of time for their piloting, they developed data to show that it was a safe way to provide services. The cost effectiveness is always a question. And so with that data that they were able to accumulate during the pilot project, they were able to, either they or perhaps an advocacy team went to the legislature to show them that this project is a viable project, that nurse practitioners can be nurse practitioners and so forth. And so the legislature makes the decision as to whether they can expand the scope of practice or not. And if the legislature passes a bill to say that this is a good expanded scope of practice, then the bill is passed, and the governor has a chance to decide whether or not he or she is going to sign that into law. And so if the governor signs it, then the Consumer Affairs Board effective boards will develop those regulations for licensing category.
Thank you so much. Are there other questions at this time? If not, I have some questions, or a couple questions to both of our, oh, okay, Sharon, your hand went up.
So I am wondering if there is any category that the legislature passed where later down the road there were problems within that category, major problems that came up.
I like to smile because once it's out of my desk, you know, I'm just so pleased. I think I will tell you that before the HWPP 171, which is the project that dealt with first trimester abortions regard for nurse practitioners and so forth, that we went through the public meeting. There was no hooray. I was expecting the big bang of people to come in and demonstrate. That didn't happen. During the pilot project itself, the legislature was so happy to, one of them, and the senators were so happy to ask us questions specific to the safety of the project. And they wanted to quote hard data, raw data, to show what was going on those projects. So when we went out to the sites and I came back to write my report up, they wanted that hard report. They wanted my written report. And I said, you can't read my handwriting. But so I sent them a typewritten report plus the handwriting from the various people who participated so they could see that what was going on. In terms of how the legislature acts, they keep an eye on us. All of our projects are very interesting to them. So they keep an eye on us at all times, and they expect to see the written reports. They may ask us for it, or they may ask somebody on the interdisciplinary team to provide comment. In terms of them saying, I don't like it, they may say that, or they may speak to us before any legislation is passed. If they don't feel that the concept is viable, they won't pass the legislation.
Thank you. Any other questions at this time? I just have a couple for both of you. So you've seen quite a few pilot programs go through where you've evaluated them and studied them. Are there any lessons learned from what you've seen that you can give advice of things we should include for sure as an evaluation tool or in a pilot program, or things that just didn't work and should probably be avoided?
Well, I learned one thing over the period of time, the Institutional Review Board approval that we have with the state and then entities within the various programs. We have to do it pursuant to HIPAA, that they must review the application before we can approve it to see whether there's an impact on the patients themselves. So we learned that right in the middle of things. I also know that sometimes applicants come in and they say, this is the time frame you want to meet to do certain things. But after the discussions through the public meeting process and others, they may find that they need to alter their time frame in trying to implement the various phases of their project. So I tend to look at them for a few weeks to see how they're progressing. And then I'll make a determination as to how often they should report to us. And if issues are coming up, or we feel that issues are coming up, or if somebody reports that issues are coming up, we'll schedule a site visit to go down and investigate whatever the question may be.
Yeah. I was just going to add that one of the things that's really probably, and maybe it kind of like melded into what it is now over the years, since this program's been around for 40 years now, is the involvement of stakeholders and the public in the decision making. So ultimately, authority is given to our director to approve a project, and there's been instances in projects where one advocacy group or stakeholder group or another is vehemently against the project, but ultimately for the greater kind of get too pie in the sky, but like greater good of getting people access to care, it's been in the best interest to pilot that project. So the director, for our director, they still have approval, they still weigh the pros and cons, and obviously we're sure we get much higher on the political level than we are. So far it goes to agency, and if it's really a sensitive subject, it goes even higher than that. But ultimately the director is the one that approves it. But the fact that we incorporate so many stakeholders, and in our case, the Healing Arts Boards, when there's a change in scope or someone wants to expand, to hear their comments, have that public meeting so that any concerns or comments from the public are addressed by the applicant. That's really vital, because that really helps. A lot of times when we just learned from just experience, when there's a certain group or advocacy group or a stakeholder that's concerned about a pilot project, just to be recognized and heard, and know that their issues are being addressed with a revision to the application, really helps, so that when things move forward, if there are additional concerns, they feel, one, they can come to us, come to the project and say, hey, I'm really worried that this is happening. Is that actually a fact, or am I just hearing things, and can you show? And we go back and forth, and we work with them and the sponsor, and then address that either was that happening or wasn't happening, and the sponsors addressed it through a revision in the application. So the application itself, once it gets approved, it's not like a fixed, you can only do this. If there's revisions they want to make, they can make those revisions. And Gloria probably go into the process of that, whether there's a new kind of public process or not, or is it just kind of revised? If it's depending on the scope of the change. If it's minimal, then they probably don't have to go through the whole process. But really, from what we found is that public process is really important to get the buy-in, for the most part. I mean, you're probably not, and we just know from experience, because healthcare is a very sensitive subject for a lot, that you're not always going to get everyone to agree on what's the best route for a project. But again, our objective is always like, we're here to test it and pilot it and number one thing is ensure safety. That's always, above all, safety is always the number one concern. So once that's addressed, we're here to make sure this works, and it's for the betterment of the state itself. So that public process is really vital. And I know we got we got a little explanation of what you guys were planning on doing, but I would say that the public process is probably one of the most important parts to ensure either buy-in or just that people are being heard.
Thank you.
Yes, the public process, as well as the feedback from the interdisciplinary team before we go to public meeting, is very vital also. So those are two avenues that we really look very hard on, what our stakeholders are from the interdisciplinary team say, and then again in public meeting where there's the discussion part, and whether they can come together on areas that may be in disagreement or not. And yes, the director has the ultimate hand in making a decision to approve or disapprove a project for piloting.
Thank you so much. I know I think Sharon had her hand up, but maybe it's down now, and definitely Leah has her hand up.
Did you have another question, Sharon?
Sharon, did you want to go first?
Sure, I can go first. Sorry.
Thank you, Leah.
I am wondering if you keep stats on aggregate data on how this has increased access to healthcare. That's the first part of my question. I'm also wondering if you keep stats on medical professionals or nurse practitioners and cases that involved medical malpractice or some other form of negligence.
Lord, we have in the HWPP program, I don't recall, I mean, the question of negligence and those kinds of things were brought up from the Senate side of the legislature and the HWP 171, the abortion project. That was a very sensitive project to them. So we looked at abstraction data. We being the interdisciplinary team and myself, we looked at abstraction records to see what was reported very deeply so that we could answer those kinds of questions regarding any issues relating to health dispensing of the project. But after that, we have not had, I don't recall any particular questions regarding malpractice. Once the concept has been approved by the legislature and signed by the governor and the scope of practice has been increased, that's out of our hands. Now, we may hear things later on, but we have not received anything after we've gone through the legislative process for approving the concept, or the governor has signed the bill relating to that. We have not received any feedback regarding what they should do. Now, it doesn't mean that they being the public can't send information to us or ask us questions. They always do. But for HWP, it's been pretty, I call calm after the storm has gone through. Now, I will say that in another demonstration project, something occurred. I always tell people, death is a bad word. So if anybody dies during your pilot project, you can just about take your hat and go, pretty much. But in one particular case, not in HWP, but in another pilot project, somebody passed away. The good part was it wasn't in our pilot project site. It was that person was sent back to the hospital wherein that individual passed away there. But we sent an MD down from our staff to investigate that issue, to bring information back. Believe me, we received more calls from the media and everybody else in the country, and all kinds of, well, why didn't you do this? Are you going to do this? Are you going to stop the project? Or are you going to do this, that, and other to the license category? So, well, we just simply indicated that we will investigate. Once pursuant to the results from the investigation, then we can make some comments. As it turns out, we're sorry that the person passed away. We know that the judgment on the pilot project site was not the best, that person should not have been sent to the clinic, to the recovery center. It should have stayed in the hospital if they were having some difficulty to begin with. So that was a judgment call on.
I'm just going to jump in. Thank you so much. I'm sorry to interrupt, but we do have another question, and that's Leah. Okay.
Sure. And this is just for both of you, following up a little bit on your comment that you've heard about what we're doing. There's some real key distinctions when we talk about a pilot. One is we are not talking about an application process, right? We're talking about shaping the pilot as a statewide agency. The State Bar would then implement a scope of practice initiative as a pilot. And so one of the things I'm struggling with to apply the healthcare model, because we often make a parallel between nurse practitioner and doctor and this licensed legal paraprofessional and a lawyer. So that paradigm is a nice analogy, but in trying to bring that into the pilot context, if you were us, so you are a statewide agency, there's no application process. You are shaping the pilot as you want to shape it, right? And understanding that this program will involve a whole new educational curriculum for these folks. You're building this from whole cloth. What tips would you give other than stakeholder input? I've got that. But even, we've talked about things around, limited geography or limited practice areas. So not all, 19 areas of the law that we're contemplating, but maybe only a few. So I'm just wondering from your experience, and if you were able to do something without an application process, how would you shape it?
My goodness. We have always looked at the application process, even when we went through an RFP to set up what we think we wanted to test. We set up an RFP to determine something in a demonstration style, the criteria, what it is we wanted to know, to learn, how long it's to go forward, who may apply. The whole thing was developed through an RFP process. So we have not ever had, in my judgment, a pilot project or a concept coming through OSHPD without having some kind of a process to it. Either the demonstration where we just talked about, like HWPP or other, or whether we ourselves design the pilot project or the concept pilot idea ourselves, developing the criteria, developing how you want to evaluate it, developing who's going to oversee it, what are the legal parameters regarding all of those kinds of things. How do we want this thing to go, and who do we want to have demonstrate the idea, and where do we want to have it in the state of California? Now, obviously, going through all 58 counties is a hardship on anyone who's going to participate in looking at anything. So you may want to consider the best judgment for where you may want to initiate the activity. Does that kind of give you an idea?
Okay.
Or did I miss something?
Yes, thank you so much. Let me just check and see if there's any other questions from anybody. Okay, and then Andrea, I wanted to just touch base with you because I know that you helped us facilitate this, and see if you wanted to add anything or sharpen anything.
Yeah, I think it's great that there's been so many questions. I think we've covered a lot. I just wanted to quickly chime in just to note that we do have Bonnie from Judicial Council here to lend us her wisdom as well. So I just wanted to note that
Yes.
we want to allow time for that also.
Okay, so unless there's any other questions, I wanted to thank our speakers, Gloria and also Orly. I'm sorry, I'm trying to get my screen right. So Hovik,
Yeah.
because I couldn't see your face, I couldn't see your name. Sorry. To thank you so much for your time. Oh, look, Julianne has something. Julie?
I do. Thank you. I just wanted to follow up on that last question, or your answer, Ms. Robertson. So most of the, and I recall these projects going back to when you used to call them manpower projects. So what you were saying just now is that for the most part, an applicant comes to you, and that applicant has the burden of producing a plan, a design, what is it that we want to test? And generally you're starting out with an already licensed category where the licensees want to expand their scope of practice, as opposed to creating a brand new licensing category. Is that what you were just saying?
No. We do that, but we also accept applications where we're talking about a new healthcare category.
Oh, okay.
As it was for the nurse practitioners and so forth. They were not licensed people. They were licensed registered nurses, but they were not nurse practitioners. So as it relates to what I think you guys may be going through, you'll be doing a new category of legal. And so, yes, that's a way of piloting the concept. But you can either do it one way by developing what you think you want to test for that concept. What might a paralegal do in XYZ setting? What are the parameters? What can they do now? What else can they do? Or if the category does not exist, then you design what you think the category ought to be.
And I can piggyback off Gloria's comments. So I'll give you an example. A couple of years, I think it was almost 2 years ago now. I don't know if everyone's here familiar with dental therapists. They're kind of the
oh yes.
I guess they're like the better, lack of a better example. They're like the nurse practitioners to dentists. So they can do everything a dentist does, with the exception of maybe some surgeries type stuff. So a few states have them. I think they started in Minnesota, and they came over and we have a lot of inquiries about the pilot project. So something like that, like a dental therapist, there's no board that covers that in California. It's a brand new topic. There are other states that do it. So when we talked to them, we said, well, it's a brand new concept, it's a brand new profession, so there's no licensing. How do you start that? So you have to find a sponsoring entity. In this case would be like a school or someone that's going to put together a curriculum to build out that profession. So it's probably very wise to limit it to few areas of the state that are going to test it, whether a couple of counties, areas that that really need the help, and it's a good place to pilot it. And there's always one big topic is always the funding. You know, how these new professions going to get paid if there's no actual licensing for it. But it seems like that's not as big an issue here yet, unless you're creating a whole new profession in the legal world. But so we basically explained you have to have someone at that level or higher oversee those dental therapists. So in this case, it had to be a dentist. So you have to have kind of see the background of how it works in the in the world of the advocacy and the stakeholders. You have to have the dental association basically back it up because they're agreeing to have the dentist, or you have to find a dentist that's basically saying, I will be the faculty member. I will teach everyone how to do those processes. The responsibility falls on me and my organization. So
now,
that's part.
One thing about that is that, and one thing we found out was that there was a suit on Alaska, for example. The dental profession sued Alaska for that. So therefore, when they came to us, whoever they might have been, they was the entity that wanted to initiate the pilot project. I said, well, I'm going to be looking at Alaska to see what happens to the suit, the legal suit.
Oh,
so one thing
hopefully we won't have that. I'm so sorry to interrupt, but we have like half an hour left for Bonnie. So I just want to check in, and I'm so sorry to interrupt, to make sure that we don't have any other questions. Julie, do you still have another question?
I'm good, thank you.
Okay, sorry. So thank you so much, Hovik and Gloria. We really appreciate your time. I'm so sorry our time is limited. Unless Andra wants to add anything, I think we should give Bonnie some time now. So thank you so much.
Thank you.
You're welcome. If you have other questions, just send us an email and we'll do what we can.
Okay, we will. We really appreciate your time and all the knowledge that you shared. Thank you.
All right, thank you, everyone.
Take care.
Thank you so much.
You're welcome.
Hi, Bonnie. It's good to see you. I think you know pretty much everyone who is here. Have you had a chance to meet Kimberly, who is a relatively new person?
Hi, nice to meet you.
And, Kimberly has our consumer affairs focus. And have you had a chance to meet our new chair, Justice Petro?
No.
Okay.
Right.
Okay. And Bonnie probably doesn't need much introduction, but I think she's like one of those rare people who wears angel wings and a halo as she walks on earth. Her DNA is like embedded in so much in California self-help centers, teaching judges how to work with self-represented litigants. She has a hand in just everything. The Providing Access and Fairness Committee, even just ethics training. I learned so much from Bonnie every time we do something together. So in the interest of time, that's my short introduction, but if you would like to introduce yourself further, Bonnie, please do, and then I'll see if Andra wants to also introduce the topic.
Thank you. You are just too kind as always. And back at you, Judge Yu.
Thanks.
No.
Andra, did you want to add anything?
Given that we have limited time, I will let Bonnie jump into it. But I think this group sort of has teed up generally what the Shriver projects are. We talked about it when we discussed pilots at the larger group meeting in January and December. And I thank you again, Bonnie, for being here and telling us more about the pilot process and evaluations and informing our own pilot discussion process.
Okay, thanks.
And make sure that everybody does know about the pilot Shriver project. Nobody needs any background on that. Because one of our meetings, people said that they did. Okay, I guess
I can do it quick. So the Shriver pilots were established in 2011, and the goal is to study the impact of to provide attorneys, but also really to study the impact of attorneys in cases where one side is traditionally represented and the other isn't. So and we've had about $8 million a year for it, and we now will be distributing 12 million this year, and ideally we'll be getting fees for about 18 million a year. And the funds go to they have to go to legal services agencies that are IOLTA funded, who can then subcontract with other legal services providers, particularly in conflict situations, and they have to be in collaboration with their court. And so sometimes that's a very intensive collaboration where the court has staff that's also funded under the grant, and sometimes it's a less intense collaboration. So we have 6 programs that are doing housing. We have 3 programs that are doing high conflict child custody issues, and 1 program that has done guardianship and conservatorship. And we've just added a couple of new programs with the new funding. So, but I can talk about, and I've had the great honor and privilege of working on the project since the beginning. And so I am happy to provide you some information on the evaluation. I'm not sure how helpful all of that is going to be. So if you don't mind, once I finish the brief description, I'll also talk about some other evaluation efforts that we've undertaken that may also be useful, or things for you to be thinking about in your efforts. So with Shriver, it was a bill by Assemblymember Fuhrer, who was very clear when he came to the Judicial Council and talked about it, is that this was not just to provide assistance, it was really to evaluate, to study. And so evaluation has been a key part, and it's been a major financial commitment. So we spend about $250,000 a year on an evaluation firm to work with us. And we also commit about that same amount of time, depending on but we commit a lot of staff time for staff evaluation and review. So a very significant evaluation, probably more than we will have funding for this project. But we now have, oh gosh, 20,000 records, close to 40,000, I guess now. I'm just trying to think of when the last, which is probably the largest database of data about legal services in the country. Wow. So so we've been able to do that from the beginning. And we contracted with an outside firm in part because the Judicial Council, as funder, does not want to have any individual information about the clients who are served. We want to be able to protect that attorney-client privilege and relationship. And they also, it's a huge amount of work, even for the outside firm to be maintaining that. So the kinds of things that we do, we ask all the programs to collect a lot of information about the clients, all the demographic information, whether their disabilities, if they have kids, what their income is, and depending on the case, what their housing situation is, a whole lot of information so we can identify what's going on, and then what their assessment is and what they do in the case, what the services that they're providing, and then what the outcome is of the case if they're providing full representation. Many of the programs provide different levels of service. So if they're providing limited scope representation, a lot of times they don't know what the outcome is, right? They prepared the paperwork, they did negotiations. Sometimes in a housing case, the landlord dismisses the case. We don't know exactly why the dismissal, if it was because the person agreed to move out and the landlord said fine, or if they realized that there were some procedural problems and just refiled the next day. We don't always have a whole lot of information in those situations. We have very comprehensive information if they provided full representation. Bonnie, so we have that database.
Sorry to interrupt. Part of one of, and you may get there, but part of what we're wondering is in the Shriver project, I know there was a committee, people applied. How did the group decide what subject matter areas to serve and what geographical areas to serve? Things like that. How did you make those decisions?
That's helpful. Thank you. The subject matter areas are set forth in statute. And then the geographic areas were just dependent on who was applying. There's an implementation committee that's set up by statute, and they looked at both the quality of the applications and then trying to get a diverse range of services. So for example, with San Diego, the program is trying to assist every low-income person who has a housing issue. Other programs are doing more triage and assessment, that kind of thing. So they went for rural, large, whatever. But it was really, frankly, largely dependent on the applications.
Oh, do you think that process worked, or do you think it would have been better to do it a different way? Could you have gotten more data if you were, you know, somebody else applied from a smaller county? Any lessons learned there?
I think there are some, I mean, it would be nice from a comparison point of view if you could say, we want you to operate your pilot in this way and we want to do comparisons. The challenge is, I mean, having reviewed, one of the things we did was we did case file review, my staff did that, and just how people practice. I mean, if you look at a housing file in San Francisco versus Bakersfield versus YOLO, whatever, they're all different. And what the common way people do things is different. For child custody, you know, it becomes a little challenging. I mean, I think there's huge value in, and in your situation, you're also going to really have to understand what the practice structure is, right? So I will say when I review files in the Central Valley, I see a ton of work done by paralegals or LDAs, excuse me. And that seems to be a very common way of providing assistance, where I don't see that as much in other jurisdictions. And in places like, you know, or in other places, you'll see way more what's clearly unbundled work done by attorneys. And then you've got what's happening in the self-help center. So I think you're going to have some sort of assessment of what is the current legal culture. And by that, I mean the broader legal culture, not just attorneys, but the broader, as I say, LDA practice and probably self-help practice. The other thing is that you, I don't know. I mean, you know, for things like landlord tenant, there is usually a pretty limited number of attorneys that practice in that area. And so I will say that, and again, looking at LDA work, because that comes up a lot when we're doing random assignment and doing comparisons and stuff, you can start telling. I mean, again, when there are 4 attorneys in a county, you know, you kind of know who they are. You kind of know what's going to happen. And again, my experience looking at LDA work is oftentimes there were 3 really good ones and 1 that was really problematic. And
oh, sorry, Bonnie. One of the things we're thinking of, and I'm just asking questions, but I want
no, thanks
to raise their hand if they'd like. One of the things we were thinking of is sort of rolling things in, right? So starting on certain tasks and then maybe rolling in things. So for example, not having paraprofessionals represent people in the courtroom right away, and then maybe seeing if that could be done later. Did you have any experience like that in the Shriver project where you started with something and then you rolled in new tasks? And if so, what was the criteria that was used?
I think the major things were changes in program design. So we had one program that very successfully has a settlement master for landlord tenant cases. And through the grant process, we encouraged other courts to try and programs to try and do that. And that, you know, that worked with some people were willing to do it because it's a change in the landlord bar practice. So it isn't necessarily just easy to do that on its own. And then I will say with the custody projects, given the statutory definition of the cases that we could take or the programs could take, a lot of times they really had to kind of adjust and see what would work. So I think it was more programmatic in that sense. So no, I can't think of something where we've really rolled out expansion. In self-help, we rolled out expansion, but again, I'd say that's more off the top in moving into more settlement assistance for people, you know, that self-help was traditionally helping people fill out papers, and now there's much more helping people talk to each other and try and work out their case.
Okay, so Julie, do you have your hand up or is that from before?
Oh, I'm sorry. That's
Oh, no problem. And Andrea?
Hi, yes. Bonnie, this is a little bit of a putting you on the spot question. So, if you don't have an answer in this moment, it's certainly understandable. But when you were talking about seeing as an example in the Central Valley, LDAs doing a lot of this work, because we're right now trying to decide what we're narrowing by geography, by practice area, by task, all of these different questions. Do you see areas where you think, like let's say housing cases in the Central Valley, where you think additional abilities for these professionals, let's say these LDAs, to do things right now that only lawyers can do would meaningfully expand access to justice? And you might not have an answer off the top of your head, but you just have this kind of 360 view of the services. And if it's like, gosh, if LDAs could just have these 2 other tasks they were allowed to do in the Central Valley on housing, that would really expand access to justice. Again, that's a very on the spot question, but if you have thoughts now off the top of your head or have thoughts in a week, I'd love to hear your perspective, having done this statewide.
Okay. Off the top, no. But I'm happy. I will be really happy to puzzle on that. Yeah.
Yeah, wonderful. Because I'm sure you've just seen, oh gosh, if these professionals that are licensed to do this could do these 4 other things only lawyers can do, that would really help us serve more clients on a certain topic area or geography.
Anybody else have any questions for Bonnie? One thing that, me, that I want us to pay attention to is language access. And I'm wondering if with the self-help centers or at Shriver, if there's anything that you learned about what factors should be considered in establishing a pilot so that we make sure that we successfully assist people who have language or LEP needs.
Well, I think whenever possible, having staff that are bilingual is extremely helpful. And then identifying ways to have good, credible interpreters and translators in situations where they're not, I think is also going to be really critical. And I mean, that raises a whole nother kind of issue, right? That you probably have been giving a lot of thought to, which is the whole issue of notarios. And what is happening in communities where they're, strong, that's a large part of the, we'll talk about legal landscape, right? But I think mostly just, trying to encourage that kind of language competency as much as possible.
Did you encounter anything? Oh, sorry, go ahead, Bonnie.
I'll just say in terms of, I mean, there are whole, and I apologize that I thought we were talking about evaluation. So let me just suggest a couple of things to think about if you're thinking about evaluation of the program.
Yeah. And
that's just like, basically, what are you trying to accomplish? Like, what is it that you think you're actually going to do? And then I or other people who, would be happy to help brainstorm how to look at that. What are you worried about? What are you trying to avoid? What is the concern? And sort of like, what are your expectations about what is going to happen? Do you think more people will file? More cases will be completed, those kinds of things. And just some cautions in terms of one study we did a while back was interviewing, we actually videotaped litigants who were in court on their own and videotaped the hearing from both perspectives, both from the judicial and the litigant perspective. And then we showed the tape of the hearing to the litigants individually, interviewed them separately, and then sort of would stop and say, well, what was the judge trying to say here? And what were you trying to say? And did you understand what was going on? That kind of thing. And interview and also taped those interviews. And so to get a sense of how well people were able to manage in that process. And I think, and then we did the same thing with judges, but we also asked judges to sort of rate how self-represented litigants did. And one of the things I think we found was that judges will often say, oh, you know, self-represented litigants always do really badly in court. And every single one of the cases that we work with, they were like, well, actually, this person did pretty well, or both sides did pretty well. They really knew how to manage and that kind of thing. So I think, you know, sort of when you're thinking about how to analyze, so one thing might be, we want people to have representation in court, and our expectation is they will do better with a paraprofessional than on their own, to be thinking about that. And also then what you don't have is, you know, we were never able to then follow up with studies where we looked at people who were represented because of getting consent from the attorney to interview their client about their experience with the process. So anyway, there's just some interesting challenges along the way. But
any questions for Bonnie in the about 15 so minutes that we have left? On evaluation, oh, Sharon has a question.
Yeah, I've got a question about evaluation. Bonnie, is there anything that you did not evaluate that in retrospect you wish you would have thought about?
Well, we're continuing. I will say, I mean, one of the things that's been really hard to get our hands around is people who are not coming for service. We know that, for example, in the San Diego program, even though they're trying to assist everyone who's low income, you know, if you look at the number of evictions and presumably low income tenants, certainly not everybody is getting to the program. And it's very hard to evaluate the null, right? To say, why isn't someone coming in? Why aren't they taking advantage of that? So I can't say that we haven't done it, but we've been sort of struggling with that. And you know, and again, the sort of, I think from the dismissal, I mean, we've changed our format to try to get that handle on why cases are dismissed. What we were able to do that, again, is something that presumably paraprofessionals might be able to do, is we really look at settlements. I mean, the reality is most cases settle, right? They're not going into court. And what we've tried to do is have very standard, like, this is what happens, so that we're not, you know, we're trying to just do very quantitative analysis. And that's certainly possible in landlord-tenant cases. It becomes very difficult in a custody case. It can be very difficult in a DV case. And unless you have a transcript of the hearing, you know, for those in other situations, you know, if you're trying to say, how did the person do in court? You can look at the pleadings and see what you think might happen based on the pleadings, but you don't know, right, what got said, or, you know, any of that kind of stuff without having the transcript. So, you know, that remains a continuing challenge.
And I suspect we're going to have the same challenges with this program as well.
Yeah. But again, it's sort of like, again, what is it that you're hoping you'll accomplish? What do you think would be different? That kind of thing. So,
Andrea, did you have your hand up?
Yeah, please correct me if I'm not framing this correctly, but my understanding with the Shriver pilots is that there's funding. I think it's like a 3-year cycle, and then the funding can be renewed for certain programs. So because we're looking at a range of what a pilot means, you know, I think one thing we're seriously considering is whether, you know, if it goes well, as Judge, you mentioned earlier, will we then scale it up and, let's say, add 2 more practice areas? Or do we just continue it? Like, what choices are we going to make based on those evaluation points? Like in your case, it was 3 years. How did the evaluations play into those checkpoints? Like, what are we going to continue funding? What are we going to fund more? Just any thoughts on how to manage that? Because the one thing that's similar to what we're looking at, our hope is that we'll get positive news and will continue, right? The goal is to do something that's successful and increases access to justice, right? So just any thoughts on how the evaluations played into what you funded and scaling up going forward?
I think it was primarily identifying areas where there were sort of innovative practices that seemed to be particularly helpful and trying to encourage them. I think that was the primary thing. I think an example that might be helpful though is when we did forms for limited scope representation back in 2000. So when it was kind of a wild and crazy idea, we started in family law because the judges were more willing, were more used to seeing unbundled services, and legal aid, you know, when we sort of went through, it was kind of like and any assistance in some levels was helpful. And then once we had a year or so under our belts, then the Civil and Small Claims Committee was willing to say, oh, okay, the world didn't fall apart. You know, this seems to be working, that kind of stuff. And they then took it, and they also actually made some really nice innovations with their rules and forms as a result. And then when we updated our forms, we incorporated some of those suggestions. So it's sort of building on each other. But I think sort of trying to identify a place or as in either a location or an area of practice where people are willing to try it is really the critical thing. And then seeing if the world falls apart.
Let's hope not.
It probably won't, but
right.
You know.
And 3 years, was that sort of, okay, we think this is meaningful enough that we'll get some good data of how successful this is, but also short enough that we can, like, I'm just curious if there was the number 3.
Yeah, that was statutory. Okay. And I have to admit, I can't remember at this point if there was a lot of discussion through that process. I mean, we did a lot of discussion with the legal services program. So the legislation itself has evaluation criteria. It's a very detailed piece of legislation. Mm-hmm. It has triage, all kinds of things in it. So yeah, I mean, I think 3 years is helpful in term, you know, from a standpoint of getting a program up, because you got to hire people and you got to figure out what you're doing and that kind of stuff in this environment. You know, that may or may not be appropriate depending on what you're doing, right?
Yeah.
I mean, it may be if you say, oh, we want people to have some level of education, then you need to add time for them to get that education and then sort of assess what happens. But
right.
Thanks, Bonnie. Any other questions for Bonnie? Okay. So let's take the last 10 minutes to kind of just do a couple things, which is see if what we heard today changes any of our previous thoughts. Our previous thought was that we were each committed in principle to a pilot program and that it would be some type of rolling program. Does that still fit, or does hearing what Bonnie or others said maybe make us question that? We may not have time to fully discuss that, and then talk about what we're going to do next time. So Andrea and I intend to meet before the next meeting to look at all the various factors that one would consider to when you build a pilot program. And what we wanted to do was think through those elements and triage what we think maybe is a basic or a threshold question, and talk about some of those things as we kind of try to build what we think our pilot program would look like, assuming we're all still committed in principle to a pilot program. So those questions are out there. Anybody want to say anything first? Any thoughts about the speakers today? Did that change anything for anybody? You're more quiet than normal, I think. So I'm wondering if that's okay.
Not for me.
Okay. And then any requests for next time?
I really want to tackle the geography issue. Are we going to have it statewide? I think that, and also, you know, I do have probably should have asked it earlier. Should we put a cap on the number of people to be able to go through the pilot program at the beginning to make it easier to monitor, or see how much of a response we get and open it up in unlimited numbers? Those are 2 issues that interest me.
Thank you, Steve. Bonnie, is there anything that you knew from either self-help centers or Shriver that might help us from your experience?
Well, I think the thing is you have to figure out what the demand is. I mean, how many people are going to want to actually do it and see. I mean, one of the other reasons it's really hard to evaluate unbundling is there are very few attorneys that have that unbundle as their practice, right? And I just don't know that there are going to be that many people who want to do this, depending on, on what the requirements are and things like that. And I just wanted to suggest the Pew Trust has really pushed on dental therapists, and they have a whole campaign, and they did so they have a whole kind of evaluation and strategy. So I'm going to send you a link to that because that might be useful. And they were very strategic about wanting to increase the number of paraprofessionals assisting with dental work.
One thing that was a theme that I thought I heard from Holvik, and then also something that Bonnie mentioned, was that it might be important to stay flexible. And then having started different things that are large projects, I know sometimes that flexibility is important so you can adjust, because maybe we find, as Steve mentioned, that people aren't really coming. So then we have to change our numbers or change how we sweep people in. And so flexibility might be something we want to just keep in mind in any pilot program. And then the other theme was, talk to your stakeholders. And I'm so glad he said that, because I think we really are trying to get more people to the table, and including those who might be served. Any other thoughts about what we heard today, or what you would like to accomplish or see us, Andrea and I, focus on for the next meetings? We have 2 more meetings and possibly a 3rd if we want it. Oh, Sharon, your hand is up.
I'm just following up on what Steve said, just the interplay of geography and substantive areas. Like, I know that with the Shriver pilot projects, you had different geographic areas. Like LA had a housing project, it had a domestic violence project, Santa Barbara had a whole different project. I'm wondering, with this particular project, in order to get enough paraprofessionals to sign up, whether it has to be more widespread. So let's say family law is on the table. Is that going to be across all jurisdictions in California versus a few different geographic areas that take that on? So I'm wondering about that.
Yeah, and something Bonnie said about, well, it depends on who comes. I'm wondering if there's some way to get some demographic or other numbers so we could, because let's say we have such great intentions and we say, let's just do this in Trinity County because it's a rural county, we want that data and there's a need. But if there's nobody who wants to be a paraprofessional there, or no school around there that can support it, maybe that's not the best thing. So I'm wondering if there's any way that we can get some of that demographic information that would help us make a decision. And I don't know, that might be quite a challenge, Andrea and Christopher, but might be helpful.
Yeah, it's a good question.
And there might be people here, like Kimberly or Julianne, or others in our working group, who may be able to guide us to points of information to help us get that data. Anything else?
Can you get data on the number of LDAs, excuse me, and where they're located?
No.
No.
We can have it, for those who belong to CALDA, but only them. There is no state. We'd have to contact each 58 county registrars to see who's registered in each county as an LDA or UDA. And we've actually tried in the past, and we couldn't even get the information that way.
That's why we need Bonnie to tell us. No, I'm just kidding.
And then what about how many paralegal schools are there operating now? Or how many paralegal programs?
We can get that information.
Because that might be another really good, they could probably give you an idea about what's happening and potentially what's happening with their graduates too.
And maybe even so, there were a lot of minority lawyers who were not a member of Santa Clara County Bar because they didn't want to be a member, they didn't want to pay. But people who were members of Santa Clara County Bar knew minority lawyers, and we could ask them questions. Maybe the CALDA or the paralegal professional organizations might be, we could do a survey or ask them. Maybe they would be able to tell us what holes there are, like, oh yeah, there's nobody practicing out there, or there's actually a group practicing there and they mostly serve Spanish speaking people, but they're not a member of CALDA. I don't know if it's worth some type of survey monkey or something like that. because we could build a wonderful program, but if it's not in the right place or people don't come, that wouldn't be so good. So it's sort of like a chicken egg, can we get the data thing?
It's complicated because it's a lot of different data points. Like I'm thinking about some of the justice desert areas around the state that don't have a lot of private attorneys, pro bono attorneys, or legal aid attorneys within a certain square mileage. Are some of those factors going to also contribute to not having enough paraprofessionals that sign up? Or is it going to be the inverse? Is it going to be something that encourages paraprofessionals to set up shop in those areas? And I just
well, remember the eligibility criteria as contemplated is folks with a JD, an LLM, or a certified paralegal pursuant to the Business and Professions Code. So that exclude LDAs, for example, are not, you know, on their face qualified or eligible to apply to be a paraprofessional. We could look at the distribution of those, I think, who have not passed the bar exam. We could look at that distribution statewide by counting. That's a data point we do have. We don't have any data on the LLM population, and there is no registry for paralegals, but we could see what the programs have. So we could at least begin to see statewide. The population I'm confident we can provide is who has not passed the bar by geographic distribution.
And Kimberly, sorry, Leah, if I cut you off. Kimberly, you have your hand up.
No, just to add on to what Leah was saying, is there any way we can identify like the top, because there are so many attorney firms out there that do like the voluntary work and the pro bono and everything. Is there any way we could get any information from some of those groups, or any of those groups? This is kind of out of my wheelhouse, but are any of those groups like statewide, and so they could show where they actually utilize their functions the largest? I'm obviously it's probably like LA County because of population, but is there any of that would assist us in kind of identifying geographic area too?
Yes, that's my cue to volunteer. Yeah, I think One Justice does gather some of those stats, and I'll have to be creative just to see what we have. Because we're a statewide organization and we do a lot of pro bono and the pro bono innovation lab for the state.
Any other thoughts before we leave? Yeah, Andrea?
We also look at the justice map, which is, you know, the California Commission on Access, you know, that entity. Forgive me, I'm like, which order are those words? But there is a justice map as well that has data that could inform. You could just look at the state and say, you know, where's housing work happening currently, all specific to legal services, but it would give us some feel for the subject area and geography. So I can, you know, share that with this group if it would be a helpful this visual.
We changed the order of those words, so it's confusing. Because it used to be called something else. Now it's like, you know, California Access to Justice Commission.
Thank you.
Yeah. Anybody else before we leave? Okay. So Andrea and Christopher, thank you for pulling this together. Bonnie, thank you so much for being here. It's good to see all of you. And our next meeting is, let's see, when is it, Andrea? Oh, you're muted.
Yes. I am reminding myself. Have a lot. Okay, the next meeting is next Tuesday. So unlike our back-to-back ones, we have a little space to strategize, and 10 a.m. on the 26th.
Yes, and you and I will strategize. So hopefully we'll use your time well. Thank you, everyone. Hope you have a good evening. Take care.
Thank you,
Bye.
everybody.
Thank you. Thank
Have
you.
a great night.
Good night.
Yeah.
Bye, Christopher.